everyone, welcome back to my channel. Today I have another nursing video for you guys. Nursing is gonna be my life for the next 17 months, so come on, join it with me. Just rejoice in the amount of studying that I need to do every week because it's gonna be a wild ride. If you'd like to see what is in my clinical bag, this lovely, ugly duffel bag, then just keep on watching.
Close till I get up, time is barely on our side. I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go.
Alright, so we're gonna get started. So for my Nursing 1 program at my school, we had to purchase a clinical kit. And in the clinical kit, this came just like this. So I'm going to go ahead and show you some of the stuff we have already used in clinicals. But I am a recycler, so I practice on things that I reuse. I just package them back up the way I found them and practice using those. So the first few things is, and I know this is weird, you guys, but I have some Kleenex boxes, and the reason why I have some Kleenex boxes is because right now we're doing wound care and catheterization. So this right here is my catheterization subject or patient, as you can see, and this right here is my wound care patient. We are learning how to pack wounds and bandage them up in a sterile field. Both catheterization and wound care are sterile field options. So I have these because I need to practice since my husband won't let me practice on him. And then I also have my care concept care mapping. We've only done one exercise in this, but they said to keep it in the bag. So I said, okay, I'll keep it in the bag. That's what I'll do. And then I have in here, this is just my completed statistic simulation demonstration that I had to do for physical assessment and a concept map for that. This just says that I completed it and that I'm proficient in the skill. There you go. And then first thing out of here is a nice big bag, and this is my wound kit bag. So everything that I need for wound care or dressing changes would be in here. So I have already used things in here. So let's take a look. So these are just some sterile gloves. I have a big pack of those. We have some tape. We have, this is an ABD, yeah, ABD pad. And then lots of 4x4 sterile gauze for packing wounds. More 4x4 sterile gauzes because we need to learn how to do it within a sterile field. And then I have, how many of these do I have? I have 1, 2, 3, 4, 5, 2 packs of the sterile cotton tipped applicators, 5 of those. I have another ABD pad. Oh, I have 3 more ABD pads. And then I have our measuring tool that we use for measuring wound size, 2 of those. And that is it in my wound care bag. And we have our skills check off next Thursday. And I am not ready. So that Kleenex box over there is going to get some use this weekend. Let me just pop everything back in. And we do have to take everything with us every Thursday to clinicals, or sim lab is what it's called too. Alright, so our next thing in here, this is my bag 2, and this is where, okay, so this is first week of school type of stuff. This is just how to apply what is it called? PPE. It's personal protective equipment. This is just the gown, mask. What else do we have in here? We have some lubricating jelly. We have some antiseptic towelettes. I have a pair of gloves. And then I have a biohazard bag. And then I have a big box of alcohol pads. We go through these like crazy. So I keep those in there. I have them in my pockets. I have them in my purse. I have them everywhere nowadays. Alright, so the next thing is, these are all of our needles. Yeah, so we have 10 millimeter needle without syringe, just a syringe, 3 mils, insulin syringe, needle safety monoject, needle 22 gauge, 21 gauge, and 1 mil without needle. So these are all of my needles. They're all packaged nicely. We haven't used those yet. And then I have more sterile gloves because we have to put these on a certain way. These are for like changing wounds, catheterizations, anything to do that with open sores. We have to use sterile gloving technique. I probably have more in here somewhere. And then in here I have nursing farm kit. So this is the little vials that we use to administer intradermal, subcutaneous, injections. So we just have little vials of different things, how to reconstitute. Oh my god, it sounds smart. And we have some needles in here as well. And then I have 2 catheter containers. One is for my exam that I have coming up, not this week, but next week. So I have to keep that sealed. And then this is the one that I've been using. And in here it's just the catheterization kit, as well as some alcohol pads and a pair of sterile gloves. So I will be using this for practice, and then this one will be for my exam. And then I have some scissors. I have a little kit here that I haven't used yet, really. It has some scissors, it has one of these forceps, it has a pen and a pen light. I really haven't used this. The attire that we have to wear, the pants are just, don't like them. They just fit awful. And then this is for stoma. This is for somebody who's had a stoma made out of their intestines, and they alleviate via a stoma bag. So this is where the bag would attach to the stoma. And then in here, this is a condom catheter. Nice. This is for our guys that need to pee and they are bedridden or they can't get out of bed. It's literally a condom. You roll it down, you attach it to a bag, and yeah, that's exciting. And I think that's it, you guys. Yep, that is it for my clinical bag. Each semester we do get a new, not a new bag, but a new kit to put into the bag. So I don't know what I'll be having next semester. I'm in week 4 of my nursing program 1. And so far, I'm above water at the moment. So I'm happy to say that I'm doing okay. It is a rigorous program. I've never studied so hard in my life for anything, ever. So it's really been an eye-opening experience. I am older, but fortunately there's a lot of older people in my program, so around the same age. 20s to like late 30s, maybe early 40s. So it's nice to know that I'm not the only one that is a little bit older in the program. But yeah, so far so good. The weeks have been flying by. What else? I guess that's it, you guys. I hope you liked this video. Give it a thumbs up if you want more nursing videos. And we have some vlogs coming up soon for you guys of the family so you can see the kids. The kids are officially on summer break and I am officially in school for the rest of the summer. So that concludes the video. I hope you guys like it and I'll see you in my next one. Bye! Wasn't gonna be me at the end of the semester like this.